Hi, this is a video lecture for ear conditions. So first off, we'll talk about clinical signs that we're going to see in animals that are dealing with ear problems. So one thing that we can see a lot of is head shaking. So if the ears are really bothering the animal, they'll be shaking their head, kind of flopping around those ears, trying to relieve some of the pressure there, or some of the irritation there. One thing though that's bad about head shaking is that if they're doing it a lot, they could end up with something called an aural hematoma. So it's aural, A-U-R-A-L, and that means, that's meaning the ear, right? And so a hematoma, if we remember, is a collection of blood under the skin. So what happens there is that blood vessels break inside the ear, and we end up with an ear full of blood in between the skin and the cartilage. So it can sometimes be just like on, like, say, the inside or the outside part of the ear. Sometimes it can be on both. So hematomas are really uncomfortable and they need to be drained to get all that blood out. We'll talk a little bit more about them a little bit later on though. We'll see we'll see ear scratching. This is apparently my first day using a computer. We'll see ear scratching. It is itchy, having an infected ear or an ear problem often. So we will see that. We'll see scratching at the ears if it's bothering them. Sometimes though, if they have allergies, you'll hear about ears and rears involved with allergies. If animals are having problems with their ears, getting infections a lot, or they're having problems with their anal glands or their bum areas getting itchy, then sometimes we have an allergy problem first. So the allergy problem is causing the skin to be inflamed, and then we're seeing a secondary infection. So it is good to know if them scratching at their ears started before or after the infection. So we have a little bit more information there to make a diagnosis with. We might see an ear wound. So ear wounds are tricky to treat because of that dog ear shaking. Because they'll flap those ears around and open up those blood vessels again, and it will just keep bleeding. So it's kind of tricky. So healing in the area is difficult. There's not as great a blood supply for healing. There's less skin to be sutured in the area, so it's hard to kind of fix those spots. And then, yeah, any kind of head scratching or shaking is going to possibly reopen that wound. Often we're just going to let those heal by second intention. So second intention healing means we don't stitch it up at all. We just let it heal open. We could also possibly use tissue glue depending on the size of the wound. And then typically ear injuries lead to deformities. They don't heal very nicely. So here's an example of one. That's a pretty big slice in that ear. That's going to be difficult to suture up. That's probably going to have to just be kept clean, kept open, possibly bandaged just to prevent the animal from shaking, and then left to heal by second intention or open healing. So ears that are infected tend to be stinky. It's a pretty common complaint because, yeah, they just reek, and you can sometimes you can pre-identify what's going to be in the ears based on the smell. So one source of ear infection can be yeast. So dogs that have yeast infections in their ear, it will smell really like it kind of smells like really stinky bread dough, like it's just kind of like rancid dough kind of smell. And then also bacterias can have bad odors as well in the ear. So different things will cause different smells, but they are usually pretty stinky. Typically infected ears are going to have some kind of discharge. So we have a couple different types. So we will describe ear mite discharge as appearing like coffee ground discharge. It looks really dry, it looks really crumbly, like old coffee grounds. Yeast infections are often kind of a brown color. If it's crusty and yellow, that's like a discharge you'll often see. Bacterial infections, it will appear purulent, right? Like there's pus in the ear. There could be blood coming from the ear if the ears are really inflamed and bleeding. It is normal to have some amount of wax or debris in the ears, different amounts for different animals, right? Like some animals tend to have more waxy ears than others and just kind of need like a weekly cleaning to keep those things looking nice. Other animals never really need a cleaning, so their ears kind of take care of it themselves. So there's a big difference between wax or debris in the ear that's normal and not infected, and any of those discharges that are listed there in number 1, right? So those coffee ground or like really yeasty or pus purulent discharge. So the only way really to figure out what is causing the infection is going to be taking a sample from the ear and doing a cytology. So we're looking to see, is it yeast, is it bacteria, what kind of bacteria, etc. And then we can clean out the ear too to get a good visualization. So often the ears are going to be really painful if they're infected, and painful ears are difficult to examine. Keep in mind that when we're using an otoscope, remember we talked about the anatomy, the normal anatomy of a dog's ear. It has an L-shaped ear canal, same with cats. So there's that vertical canal and the horizontal canal. We need to be able to pull up to get that, that otoscope tip into the horizontal canal to be able to visualize that tympanic membrane or the eardrum. That can be difficult to do, especially if the inside those ear canals are really inflamed or swollen and painful. That's going to be tricky to treat. So a painful ear, usually the dog is going, or the cat is going to be reactive when you touch it. If they are very reactive and we can't examine, we might need to give the animal some sedation or get some pain medications on board before we start really treating the animal. And then once it's kind of settled down a bit, then clean out the ear, get a proper exam, etc. So we could see a head tilt. Head tilts can happen with inner ear, outer ear, or middle ear infections. Or they can be associated with vestibular problems as well. So that's that sense of equilibrium in the brain. So if there's irritation in the ear, they might be just kind of tipping their ear, or their head to the side to try to relieve some of the pressure in there. Or it could be that they do have nerve problems in the area as well. Just kind of skipping ahead a little bit. So the ear canal, if it's infected, will often be really swollen. So the ear canal will certainly be swollen. You might even see swelling on the pinna, which remember is the outside kind of projection of the ear that we can see. We can also see like those aural hematomas where it's become swollen with blood. So if the ear canal is really swollen, we probably may or may not be able to do an otoscopy exam, so to be able to actually see that tympanic membrane. If it's really swollen and we can't get a otoscope tip into the ear, we're not going to be able to really visualize anything. In those cases, often the doctor will send the animal home with some anti-inflammatories first to let that swelling come down, and then we can go with treatment further from there. And aural hematomas we already kind of talked about, and we'll talk a little bit further about them a little later on. So again, infected ears tend to have lots of redness or erythema. Erythema is the word for red skin. So we'll see redness, pruritus, and heat. Pruritus, remember, is itching, and those are a sign of allergies if that's all we're seeing, is that redness and the itchiness and they feel hot to the touch. If there's no discharge or weird smell, that is most likely going to be an allergy issue then. And then they list the reasons why it could be allergies here. So seasonal allergies, food allergies, a drug reaction, insect bite, hypersensitivity, etc. And then deafness can be a sign of ear problems as well. So deafness can be a little bit tricky to detect in a dog because sometimes they might just be ignoring you. Sometimes they just don't want to do what you're asking them to do, so they just pretend they can't hear you. And then especially if it's unilateral, so meaning just on one side that they're deaf, then they can still hear, right? So it's kind of hard to tell if they have any hearing loss. Often, as well, Dogs can detect vibrations as well. So that can be a little bit tricky then, because it can still react to some of that stimuli, right? So there is a test that can be done. It's called the Bayer test, and it detects like the electrical activity happening in the ear, so we can see if the ear is actually functioning properly. And I did post a video in the ear notes there for you to have a look at and watch, that gives you some details about that Bayer test. So diagnostic techniques. How do we diagnose an ear problem in a dog or a cat? So first of all, we're just going to look at the ear, and we can look at that ear with an otoscope. So oto meaning ear and scope meaning an instrument to examine. So we can do otoscopy with an otoscope, and in order to do that, we do need to pull that ear so that we can get right to the tympanic membrane. So sometimes it can be tricky to do an otoscope examination when that ear is really painful and swollen. So this is a picture of an otoscope. So there's like a little handle here, and then usually this head can come off and switch out with an ophthalmoscope. So this is like kind of basically the battery pack, and then there's the otoscope. So this otoscope, this black part here at the end, is actually a little tiny magnifying glass, and then there's a little light in there that shines through the otoscope tip. So the tip serves to focus the light right down into the end of the ear. So we'll see the tips have different sizes and styles and thickness. You can use like a short, thin one for, let's say, a cat ear or a ferret ear. But if you have like a Great Dane or something, you're going to want to use the really long and fatter tips that you can visualize that ear a bit better. I did post some videos. I've worked in a clinic with a video otoscope, and it's actually really cool because the client can see what you see in the ear up on a TV screen. So that's really awesome. I did post a couple of videos of video otoscopy. So you can have a look at those. One I posted is like a fairly normal ear. There's definitely hair in the ear canal, a little bit of wax here or there, but it's fairly normal. You'll see the skin looks really like a pale pink. It's not red or inflamed at all. There's no lesions. And then I posted another one for you that has ear mites, and you can actually see the ear mites crawling around in the debris in the video. So it's really cool. You should give that a watch. So we can also diagnose ear problems with ear swabs. So what we're going to do is take a small sample from the ear with like a cotton-tipped applicator. So it basically looks like a Q-tip, that kind of cotton wrapped around the end of a wooden stick. So usually what the doctor will do is they'll take a sample from both ears, and to mark the ear that is the left ear, they will break the stick so that it makes an L. So that's like kind of a cool, handy way to mark which ear swab is which ear. So we can do a couple things with it. We can do an ear cytology. To do an ear cytology, we're going to roll that material onto a slide. We can heat fix it and stain it, and then we're going to look at it under the microscope. We'll be able to see if there are bacteria or yeast in that ear by looking at that kind of slide. We could also do a culture and sensitivity, which means it's sent to a lab. They try to grow bacteria from the sample. If it does grow bacteria, they isolate it and tell you what kind of bacteria it is, and then they also tell you what antibiotics will kill that bacteria. And we can also do a wet prep or a wet mount slide, and that is when we put it like we put the material onto a slide with a little bit of mineral oil. Typically we're going to do that to look for mites. So cytology, we're usually going to look at it in-house. The technologists do that, and it's really pretty quick and easy. So we can look for mites. That's this guy here. That's a little mite under the microscope, an ear mite. We can look for yeast, which are these guys. I say they kind of look like little footprints or snowmen. You can see they're budding, right? So they've got these little like, snowman heads coming off of them. We also have cockeye. So cockeye are all these little purple dots. Those are small round bacteria. Oh my goodness, I don't know why this keeps zooming like this on me. And then lastly, we have rods. So rods are long, skinny bacteria that look like little lines. So these are all a bunch of rods in the ear. So different types of bacteria are going to require, or yeast or whatever, are going to require different treatments. So we need to know which type of infection is present to know which type of drug to use to treat it. So doing a cytology in-house like that just takes a couple minutes. I can have a result for the doctor in under 5 minutes for sure. If we need to do a culture and sensitivity, it needs to be sent to the lab, and then the test itself takes anywhere between a couple days to like a whole week. So it's a little bit longer of results for that one. So if we suspect that there's allergies present, we might need to do allergy testing. Same idea that we already talked about with the skin, right? So I'm not going to get super into these. And then if we suspect an animal is deaf, we can have them tested for deafness with that Bayer test. Some people might not want to do that Bayer test. You could just try it, like one way we'll try to do is like kind of like, you know, hide behind the dog and then just like clap and see if the dog looks around. If they don't respond to sudden loud noises, it's likely that they are deaf. Okay, so treatments. How can we treat ear infections or ear problems in general? So usually if it is like an ear infection, our plan is to go ahead and clean out the ear and then give a topical medication that goes directly into the ear. A lot of the ear medications are going to be a mix of different types of drugs. So there's an antibiotic in there, there's an antifungal in there, sometimes they have a steroid, so the steroid will reduce some swelling, right? So there are different possibilities there. If we have a really persistent ear infection, then we're probably going to want to do that culture and sensitivity so that we can confirm what type of bacteria or, well, usually it's bacteria that we're concerned about, so that we can attack it with the correct drug that will kill it. So one thing that we need to know is that we shouldn't be using like ear cleaners to clean the ears unless we have identified that the tympanic membrane is intact. So we do need to do that tympanic membrane exam with the otoscope to make sure that we're not pouring ear cleaner directly into the ear with a broken eardrum, meaning that we're contaminating that middle and inner ear. So we also then, we want to clean out the ear so that we can get really good contact with that medication. Dirty ears block the medication from treating the ear because the drugs can't get to the ear if they're coated in gunk, right? So that's usually why we treat first. Okay, so topical medications, that we're usually talking drops or ointments there. Again, we want to make sure we're not contaminating the tip of the bottle, so we don't want to like touch the ear with the bottle. And we want to make sure that we're keeping them in the refrigerator if they need to be kept there. With most ear infections, we're going to ask the owner to treat for like 10 to 14 days, somewhere in there, and then we're going to have them come back for a recheck. We have them come back for a recheck to make sure that the drugs worked and that the infection is gone. If it's not gone, then we need to step up our game and do that culture and sensitivity and find out what drug will treat this illness. So at the recheck time, we want to ask the owners not to medicate because otherwise it's just this big goopy mess inside the ear. So you can give topical medications combined with systemic drugs if needed. I'm just kind of looking through these to see if there's anything really important for me to highlight here. So we want to squirt those drugs right into the ear canal. I think every vet I've ever worked for has always listed a number of drops. So like place 5 drops into the left ear. So what I tell owners is it's sometimes hard to see the drops coming out because that tip might be kind of dripping right into the ear canal. So I usually tell them to just kind of like count seconds, or like squeeze, you know, kind of like 1, 2, 3, 4, 5. But I'll, like, when I'm giving ear meds in clinic, I just kind of squeeze it and I go like 1, 2, 3, 4, 5, and then I assume that's the 5 drops. And then, yeah, like I said, it seems like most doctors will just routinely book that recheck. And then when we do have the recheck, we want to make sure that that it has cleared up the entire infection. Sometimes owners are bad for this. Antibiotics need to be given for the full course of treatment. So if we ask the owner to give it for 12 days or 14 days and the dog starts feeling better after like 5 days, we do not want to stop that medication. What happens is that the antibiotic has brought the bacterial levels down for the first like 5 days of treatment, so the animal starts to feel better. But the infection isn't completely eradicated at 5 days. It's just been brought to a level that's like manageable by the owner or by the pet. If we stop giving the medication there, those bacteria that are still hanging around in there are going to start multiplying again, and it's going to reinfect the animal. They're going to become infected again. But this time, it's going to be a stronger bacteria now that we have to try to kill off. That's because the bacteria that die first are going to be the ones that are weaker. The stronger ones are the ones that stick around. So if those only strong ones remain and then we let them continue to multiply, now we're kind of giving ourselves that, like, you know, I'm sure you've heard of like super bugs. That's kind of what that's talking about, right? So we need to make sure we give that antibiotic for the entire course of treatment to make sure that we do completely eradicate the infection. So systemic medications can be used. I have seen doctors send home like a steroid if the ears are really inflamed. But typically the topical medications are going to work just fine for the average ear infection. One thing I will highlight is that there are injectable drugs that are kind of handy. So there's one called Convenia. Convenia is so convenient because it is an antibiotic injection that stays in the system and is slowly released over 2 weeks. So that means the owner doesn't need to give antibiotic pills at home. If they're not being sent home with a topical as well, they don't have to worry about putting ear meds in the ears. So it is super convenient for the owner to be able to use that injectable if it is, you know, if it will treat the illness that the animal has. So one of the problems with really severe otitis, so otitis is inflammation of the ear, is that sometimes we can't see if that tympanic membrane is intact. And sometimes we can't see like foreign bodies or ear mites or tumors if that ear canal is really swollen. So that's why often topical medications do have a steroid in them. It'll help kind of bring down that swelling. If it is really bad, we might have the owner do that steroid for a few days and then come back for us to visualize. So we need to visualize before we can clean and give other drugs. Yes, this is a good point. Some dogs have underlying causes for ear infections, things that, like, some animals are more prone to it, right? So, so we talk about ear conformation or breed, things like Cocker Spaniels, they have those long, heavy ears that just traps all the moisture in the ear and makes them more likely to have ear infections. Dogs that like to go swimming or they play in the snow or you give them frequent baths, we tend to see a lot more ear infections in. So things like Labs and Goldens that love swimming out at your lake, those guys seem to often get ear infections. And then any animals with like allergies or a systemic illness like Cushing's or diabetes are more likely to get those ear infections as well. So antibiotics obviously are going to be great for treating infections that are bacterial. So there are side effects. We've talked about these already in some of our other discussions of illnesses. But one definitely side effect that can happen is that an antibiotic drug can wipe out the normal flora in the gut. So what happens then is that we might see like vomiting or diarrhea. So probiotics could be a good idea to send home, especially if you have a dog with a sensitive stomach. So it is nice to use a topical if you can, just because you avoid those kind of side effects, because they're not going to get diarrhea from putting antibiotic directly into the ear, and that's where we need the antibiotic, because that's where the infection is. So it does make a lot of sense to use that topical medication when you do have an ear infection, assuming that it is otitis externa, or the external ear canal that's infected. If it is like middle or inner ear, sometimes we do need to start looking more at the systemics, because it's just not going to get in there, the topical. So we talked about anti-inflammatories, so you could use NSAIDs, which are non-steroidal anti-inflammatory drugs. So an example for that would be like Metacam, or Remedies, or Deramax. Those are all NSAIDs that are specifically for animals. We could also use steroids, but we don't want to mix the two. Just kind of skipping around here. Yeah, steroids, again, those guys are going to reduce inflammation, especially with allergy situations. So it will help with pruritus or itchiness in the ear. It will reduce that. The problem with steroids, though, is that we don't want to have the animal on them for a long time. If you guys remember learning about in our endocrine system, the steroid drugs, so like the corticosteroids, cortisone, those guys, or cortisol, I mean, those guys are affecting every cell in the body. They have a lot of effects, and they can cause problems. Things like lowered immunity, we see like metabolism issues, etc. So it's not a good idea to have them on steroids for a long time. We also talked about that we want to taper off the dose. We don't want to just suddenly stop, because we could cause like an Addisonian crisis. We also need to be aware that those dogs are going to be PUPD and PP, so polyuria, polydipsia, polyphagia. They're drinking a lot, they're peeing a lot, and they need to eat. So we don't want to restrict their water. Sometimes people think that that's a good idea, but that's silly. So ear cleaning is a great thing to do treatment-wise. We just get all the gunk out of the ear, right? We want to use an ear cleaner for that. So they're called ceraminolytics. Ceramin is earwax, right? And lytic means breaking up. So they are, they help to dissolve like the wax and all the junk that's in the ear, so that we can clean them out. So some pets it might be a good idea to clean out their ears regularly, especially if they are one of those kind of at-risk dogs. So like once a week is plenty to just give them a little bit of an ear cleaning. And then anytime they have an ear infection, we do want to clean out those ears really well before starting the medication. So lots of ear cleaners are going to have alcohol in there, because that will help the ear to dry out, right? Well, when we think about what gives an infection, it's like, or what helps bacteria to grow, it's warm, moist, dark places, and that's exactly what an ear is. So if we have alcohol in there, it's going to help to dry out that ear. You can't use an ear cleaner though if the eardrum is perforated, so just so you know, that is not an option. We need to use just saline or something if that ear canal is opened, or sorry, if that eardrum is opened. Usually the vet's going to have a specific cleaner in mind. Oh man, there's so many different at-home remedies people will use. We don't recommend any of them. Just come and get your pet checked, and then we can tell you what the best thing to do is. And then sometimes we may need to do surgery in an ear. I'm just kind of scrolling down here. We have a lot of talk about surgery here. So sometimes there may need to be surgery in the ear, like a tumor removal. Sometimes I've only ever seen one dog with an ear canal ablation in like my lifetime career. That's where we basically remove the ear canal. It was a Cocker Spaniel, and it just basically had constant ear infections. It was terrible. We will see a lot of oral hematomas surgeries done though. So most surgeries are going to need to be done under anesthetic. So generally a general anesthetic because the ears can be really sensitive. So this is gives you a picture of what is being removed from the ear canal, and this is a picture of a dog after an ear canal ablation. There's some other examples here of different kinds of surgeries. You can have a read through those. They're not that very common, so I'm not going to spend a ton of time talking about them. If an animal has a foreign body in the ear, we may need to remove it. So it's nice if we can just sedate the animal and be able to remove it with like some hemostats or something. Usually though, we will need to sedate to be able to remove a foreign body. And then oral hematoma, I did place a video in the Bright Space, so you can watch a video of an oral hematoma surgery. And then if we do have ear mites present, we're going to give an antiparasitic that's going to kill off ear mites. Revolution's a pretty good drug that really does take care of those guys really nicely. Oh my goodness, I'm just going to scroll this back here. So again, we're going to want to clean out those ears first before giving the, we want to try to get out as much bugs and as much bug debris as we can before giving the drugs that will kill off those mites.